Dr. Andrew Scott is here with me now, and I know you are delivering the oncology and therapy highlights at this year's meeting. Can you give us a bit of a preview?
So I'm excited to give the oncology highlights talk at this year's SNMMI meeting. There are over 700 abstracts for oncology in this year's meeting, which is almost a half of all of the presented abstracts. And within that, there are some terrific presentations on both diagnostic and therapeutic nuclear medicine. One key thing is the importance of oncology in clinical practice in medicine nowadays and the advances which are occurring. The American Society of Clinical Oncology in the last 12 months has actually announced 5 major advances, one of which is actually nuclear medicine therapeutic, which is the lutetium-177 dotatate treatment for neuroendocrine tumours. So the fact that nuclear medicine is actually prominent on the world stage is a great advance. One of the key things that we're seeing here also is the way in which machine learning, artificial intelligence is contributing to nuclear medicine practice. But the key issue that we face is because nuclear medicine is a very functional modality, we must engage more with our patients. A lot of the abstracts have shown that we need to get clinical information from patients to understand the history of what's happening with their cancer in order to be able to more effectively diagnose what is happening with the stage of disease and what the best treatments will be.
So with this greater inclusion of nuclear medicine in oncology,
Yes.
What do you see as great advancements coming up in terms of research, in terms of therapy?
Yes. I think it fits into 2 main areas. The first is there are some new probes which are being developed that can look at the way in which cancer works. New probes that are giving us insights as to which patients are best to be treated with different therapies, and new probes which can tell us if they're responding to treatment early in their treatment course. So we don't have patients getting treatments that can have side effects that aren't really working, and they can be directed to the treatments which are most appropriate.
It sounds like it's moving more toward the idea of personalized medicine.
That's exactly right. And particularly where there are some really exciting new therapeutic treatments in not just neuroendocrine tumours but also prostate cancer. A lot of presentations here at this meeting are looking at ways that we can actually treat prostate cancer with new theranostic and radiopharmaceutical treatments. I think one of the key issues here that we're seeing is that the ability to collaborate is becoming more evident. We have to do that in order to be able to get more effective treatments. So clinical trials that are multi-centre, even multinational, are increasing in number. And for oncology patients, we're seeing a lot of these new multi-centre trials presented at this meeting.
When you're talking about theranostics, you're talking about that combination of diagnostics and therapy.
Correct.
Is that the wave of the future?
Undoubtedly, and this provides quite a few challenges for us because we have to make sure that people understand how best to use the diagnostic and therapeutic components of what we do. We need to ensure that our patients understand the importance of being able to do both the diagnostic tests leading into the therapy. And because there are so many coming, we have to be very careful that we understand which is the best way to treat. But these are exciting times.
They certainly are.
Yes.
Thank you so much.
Thank you.